Hello.
Hello.
Hello, everyone that is starting to join us. I did allow the waiting room to come in a little bit early. And just so you know, we still have a couple more minutes before we'll get started.
Hello.
Hello, Dean Mosman.
Been so long since I saw you, Amy.
I know. So people are starting to come in now. Just everyone that is waiting, we do have a minute or two to go, but I did allow people in to start to get in and get comfortable, and we'll get started right at 4. All right, well, it's 4 o'clock now and no one's joined in the past 30 seconds or so. So it looks like we may be ready to go. So welcome, everyone. Welcome to January's session of our virtual info session. So this is to give you an overlook on MCPHS as well as NISA and all of the programs that we offer within acupuncture here. Please use the question and answer box. You feel free to ask questions throughout. I will be monitoring that box. And we also are open to questions at the end. So try to make sure that we have all of your questions answered. My name is Amy. I am the Associate Director of Admissions here at MCPHS and the admissions rep for all things NISA. And I'm also joined by Dean Mosman as well as Amber, one of our current students. So if you guys would like to introduce yourself, feel free.
Hey, good evening, I guess evening for most of you, maybe afternoon to everyone. My name is Dennis Mosman. I am the Dean at New England School of Acupuncture. I am a licensed acupuncturist in New York and Massachusetts. I am a chiropractor. I have been involved in acupuncture education for, I don't know, the last 24 years. I have been the president of other acupuncture colleges. I have worked as a commissioner for the National Certification Commission for Acupuncture and Oriental Medicine. I have been an accreditation task force member to help develop the standards for our doctoral programs in the profession. And I am a staunch supporter of the profession of acupuncture in the United States. So welcome. I hope we're able to answer some of your questions about our programs here at NISA.
And I'm Amber. I am a second-year student and I am in the Masters of Acupuncture program. I also do some tutoring here at the school and um, also part of our student organization as well.
Great, thank you. All right, so let's get into it here, as long as my screen will move. So a little bit of stats about us. So we are everything healthcare. So on this campus, we have programs that range from various clinical programs, and healthcare is growing. So this is a good spot for us to be in. Employment is soaring. So we're seeing growth from 2020 to 2030 on more of an average than some of your other occupations that you may be looking at. So we have over 100 plus programs here at MCPHS, and we just celebrated our bicentennial anniversary. So we're going on 200 plus years of education, and proven successful education. We started in Boston. If you look at any of our Boston programs, you'll notice that they're predominantly undergraduate. So all of our undergraduate programs are held on that campus, while here in Worcester, as well on our Manchester campus, we have all graduate programs. So it is a little bit of a different variety, and it's going to be a little bit of a different atmosphere on this campus, because it is what we like to call more of a professional campus. These are our professional clinical programs. Along with that, we have a lot of students coming from a lot of different places. So over 74 countries, as well as all 50 states, represented about 7,500 enrolled students. So you'll also see that within our programs of acupuncture, that we will be seeing students from not only all around the United States, but from all around the world. We are lucky enough to have clinical affiliations with some of the best hospitals that I feel that some of the United States has to offer, not just Massachusetts. So Mass General Hospital, Boston Children's Hospital, you see Brigham and Women's here. We have students that will work with Tufts as well, and some of those bigger name clinical affiliations. So a little bit about Worcester. So all of our acupuncture on campus programs are housed on our Worcester campus. You have a beautiful brand new building that I love spending time in. But Worcester in general is the second largest city in New England. So also known as the heart of the Commonwealth. So if you look at a map and you go map of Massachusetts and you're going to find Worcester, look right in the center, because that's where we are. So also really convenient that if you are maybe coming from Boston or something, being close to that city is something important of you. We're just about an hour away, and we do have a train station right here in downtown Worcester. You can hop on the train, be in the city an hour, or depending, maybe a little over an hour, but typically within an hour's time. And we also are about an hour-ish away from Springfield, Massachusetts. So that's going to be our next biggest city to our west. So being centralized in Massachusetts is really something that's very helpful to us. And Worcester is growing. From someone who has I've lived here full-time for the past 12 years. I also went to school in Worcester about 20 years ago. So to really watch this city transform, we have a brand new baseball stadium here in Worcester called Polar Park, if anyone is familiar. So there are restaurants galore, activities to be done. Just a lot going on in the city. So a really cool place to be, an active social community. There is time for social life outside of school. So we do try to, assure students that there is time to go out to dinner. There is time to do things on the weekends, even though, Monday through Friday may be a little school focused. There is time for those other things. And along with the clinical opportunities in Boston, we have great clinical opportunities right here in our backyard. So we have the UMass hospital system prevalent here in central Massachusetts, St. Vincent Hospital. If I walk out of my office and look down the road, I can see the entrance to the hospital right there. So very convenient for our students to have access to all of that healthcare very close by. I think that my favorite thing about living in Worcester is that all the food I can get as an option. Worcester is kind of transformed into this foodie city, which I love because it was not like this when I was a younger student here in the city. So I worked with international students quite a bit, and I used to tell them, my challenge to you is to not be able to find what you want here in the city of Worcester. So very hard not to find what they were looking for. So having that diversity in the city, I think, is great. Amber, as a student, you as a current student now, I'm no longer a student. What would you say your favorite thing about being here in Worcester is?
I would also have to agree with you about the food options. Um, it's nice because there's so many different options and they're very close to the school too. So we'll go out even with like our classmates and just grab lunch real quick. Also like at the end of semesters, sometimes we'll go out to dinner and celebrate. So it's just nice being like central and like right here to go to everything. I also like some greenery, so there are some nice parks nearby. So I like sometimes getting out and going for a walk and getting some like relaxing space for a while. So that's also a plus.
Great. Thank you. I do see that we do have a question in terms of acupuncture being accessible to certain populations. I'm going to bring that question up when we're talking about the program details and the curriculum and clinical sites. So thank you for the question, but I have a feeling we're going to be able to answer this a little bit later on. So I'm going to keep it there and we will address it with that slide. So just to let everyone know, I am keeping an eye on that question and answer box, and we will get all of those questions answered. So being on campus. So one great thing about the Worcester campus is a variety of housing options for our students. So some of our students that may be very local on this call, housing may not be something at the top of the list, but I do like to point out that we do have a variety of options, and they're also very convenient because it's pretty much like a roll out of bed, roll into class type of situation, if that is something that you want available to you. So we have everything kind of from your more traditional dorm style, so suite style, so you could have up to 6 or 8 roommates. You would have your own private bedroom, but you would share common space like bathroom, kitchen, living room. We also have some options to live by yourself. So we have some very small studio apartments that are up around the corner from the program. So again, about a 5-minute walk to campus, to class. Those are small studios with a kitchenette type of setup. So again, you would have everything private, but it's more that open room layout. We also have 2-bedroom condos and 2-bedroom apartments. So the picture up on the right-hand corner here is actually a picture of our 2-bedroom condos. So they are very high ceilings, shiny wood floors. They are going to be your most expensive option because they have the most amenities. So in these amenities, you have your own bathroom, and so you share common living room and kitchen areas. While in some of the other options, you can look around to see different amenities and what's offered. On our website, we do have photos, and through YouTube, we have some virtual tours of all of these spaces. We've got, floor plans and different pricings that you can play around with to kind of see what would best work for you. We have students that sometimes live full-time on campus, or sometimes they will sign the housing lease for that year and use it on a part-time basis. Kind of up to you, but just to let you know that that option is there. Amber, would you like to touch upon a little bit about housing from a student perspective rather than my perspective?
Yeah, absolutely. So I was moving from Maine, so I wasn't super familiar with the Worcester area. So I thought it was a great option for me to like live on campus, learn the area, be close to school, and like find out what I wanted to do. So I actually lived on in the Lincoln building, which was a nice setup for me because it's basically like a little studio where you have your own bathroom, you have like a place to study. They also have like really nice study areas in that building as well, and a little courtyard which had some greenery. Like I said, I like that. But it was just nice because I had my own space, but it like let me get introduced to the area and what I wanted to do from there. So it was really nice, and really nice waking up and then just walking to class real quick.
Especially on days like today. I don't know if anyone on the call is from the local area. When we're dealing with slush and snow and ice, it's nice to be able to have that short walk right to class. So a little bit about There we go. There are the rest of our programs. So graduate and professional areas of study here. So one great thing about MCPHS is that we are not just an acupuncture school. We're also not just an optometry school or nursing school. Yes, we are focused on the areas of health science, but this really gives you an opportunity to be around other professions. So yes, you're going to be hard at work studying acupuncture, but you're also going to have the opportunity to work with these other students to really learn their professions, how they treat patients. And that could be similar to how you treat your patients, or it could be very different as to how you treat your patients. But just knowing that you're going to have all of these other people around you. So when we think about, approaching healthcare, not just through a physician assistant's eyes, but looking at through kind of that general healthcare. How would an acupuncturist look at this patient? How would an optometrist look at this patient? So really having those other areas of study around you, I think really benefits you. And on the next slide, we're going to talk a little bit more in depth that, and I'm going to let Dean Mosman and Amber kind of go a little bit more into details on their experience with it, but really how we collaborate all of these programs together. And we call it interprofessional education. So I will let you two talk a little bit more in detail on this as the experts.
Okay. So the great thing about NISA and MCP is and this is in a slide as we move forward through the PowerPoint deck. NISA is the oldest acupuncture college in the United States. We have been around for almost 50 years. In 2025, we'll celebrate our 50th anniversary. Not quite as impressive as 200 years for MCPHS University, but it's still very impressive for acupuncture institutions in the United States. And so one of the nice things is you have this long-standing history of New England School of Acupuncture, which has always been committed to teaching kind of like classical and traditional Chinese medicine, but in a modern way. And then in 2016, NISA, and that's the acronym for our lovely school, NISA merged with MCPHS, and we have been able to kind of take that classical traditional approach and be able to merge it with the more modern biomedical kind of healthcare system that we have in the United States. And one of the ways in which we're able to kind of marry these two different thoughts on healthcare is through interprofessional education opportunities. And as Amy said in the previous slide, you can see we have a lot of different graduate programs from a lot of other healthcare disciplines. We're talking about things, like Amber said, she lives in a dorm over on one end of the campus in the Lincoln building. You're going to be rooming with students from all of these other professions, and you're going to be sharing common spaces and eating and loitering throughout Worcester in different ways with your fellow students at MCPHS, and even just the casual conversation between students has a very interprofessional feel. And then there are actual formal interprofessional education training opportunities where students from different disciplines get together and maybe study something together. Maybe they do an unfolding case study where they talk about a specific case and how students from different disciplines would treat that. And this idea of collaborative care is something that is so important in healthcare today, because when we talk about patient-centered care, true patient-centered care it's happening from professionals in many different other health disciplines. And it's so important for that to be collaborative in nature, right? If your parents or sibling is being treated for some condition, you want all of the different healthcare practitioners that are treating your family member or loved one communicating, cooperating, and collaborating to really bring about the best patient care possible for your loved one. And that's what's happening in healthcare today. It used to be very siloed in how we managed patients, right? A patient's primary care provider may or may not be communicating with a specialist, and a specialist may or may not be communicating with a physical therapist or an acupuncturist or a chiropractor. Patients no longer will stand for this kind of isolationist type of care. They want that their healthcare team communicate and collaborate together to really bring about the best results. And I think that's what interprofessional education is all about. And the fact that we have so many programs here allows us to have, multiple interprofessional education opportunities for our students. And I'll let Amber talk about maybe her experience with, one or more of those opportunities.
Yeah, absolutely. So that the interprofessional aspect of NISA is probably what the most reason why I chose to come to this school. I come from like a scientist background, so I love that you're like incorporating multiple professions and being able to communicate together. We actually have these interprofessional events, so we get to meet with other students from other programs and we'll discuss cases. We did one recently with the physical therapy students and how you would treat low back pain. What would our diagnosis be versus their diagnosis, and how could we work together to best help that patient? We've also done ones around the opioid crisis, which can be very overwhelming for a lot of professions. But when we all like came together and talked about different ways that we could support one another and our patients through this process, it was very very rewarding. So it's something that I am very proud that I came to this school to do.
Great. So again, kind of along the same lines, we're bringing health sciences together. So a little bit about kind of what we look at from what we look like from this angle is, so about 826 faculty members. So lots of faculty here at MCPHS. 90% of them hold are full-time faculty and hold terminal degrees in their field. So these are faculty members that, they didn't just apply for an academic position. They are coming from the field. They have worked in the field. They are your first colleagues. And I think that also, especially being a professional graduate program, your faculty members are your first point of contact. They are going to look at you as yes, you are my students, but you're also my future colleague, because, these faculty members are going to be out in the field. So having relationships with them from the beginning is only going to strengthen you as a student, and eventually coming out as a professional. State-of-the-art facilities. I will say I love NISA's building. I got to watch it be constructed and designed, and the clinic going and being put together piece by piece. And it is a beautiful building. I always say that I always feel a little more calm when I walk in that building, because it's a very relaxing vibe, which I love. So it's a great place to be. And we have all the things that you need. So anything that you need to be a successful student, we have it and we will provide it. Amber mentioned that she works as a tutor. I know that she has also been involved in student life and things going on campus. So we have advisors, we have tutors, any kind of accommodation that you may need for academics. We are here to provide it. We are here to help you through the process. With that, Amber, I am going to let you talk a little bit more on this, or Dean Mosman, please feel free to jump in from you guys working with students, and Amber, you as a student utilizing some of these options.
Yeah, I just wanted to just talk a little bit about, another one of these benefits at being at a health sciences university of this kind of stature is that student success piece. So NISA has always been, dedicated to student success, and coming to a larger university has allowed us to provide a level of student support that is, just multiplied from the support that we were able to deliver previously. Many acupuncture colleges are standalone schools where they only offer acupuncture programs. I've worked at several of them around the country, and at those schools, there's like one person to help with student support. That person might also be the career services counselor. They might also moonlight in financial aid. It's very different here at MCPHS. There are entire departments dedicated to student success, right? So the Center for Academic Success and Enrichment, which we call CASE, they're helping to provide, better study services to students. This is where the tutors and the mentors and the academic coaches are. There's a whole career development office, which will help you to find a job and help you to refine your CV and write letters of intent. We have a whole office of student access and accommodations. There's a tremendous amount of student support here at the university that you don't find in some other schools. I'll go back to the faculty and facilities. I have to say, I've come from several other schools. Before I came to NISA, we had very small facilities, a very small campus. The university built NISA a building, a state-of-the-art building with a beautiful acupuncture patient treatment center on its first floor. You're not going to find this in many other places. I continue to see people surprised when they come to visit campus, whether it's another acupuncture professional or, for example, the new dean of the School of Physical Therapy came through, and I toured her through the school, and her jaw dropped when she saw the student clinic that we have for acupuncture services for the community treatment center. I can't stress enough these kinds of perks that you're going to get at New England School of Acupuncture. And as Amy said, it's a faculty of practitioners. So in your classes, you're going to be taught by people who are actually out in the world treating and seeing patients as acupuncturists. I'll let Amber speak to her.
I will say too, a lot of the other students from other programs are very impressed by our building and are a little bit jealous. Yeah, just a little. And so I am a tutor, and not only am I a tutor, but I also used tutoring my first year. I was coming from a place where I was working in a lab, so I had never worked with people before and palpation, and it was all very new to me. I also had been out of school for a while, so I was like, can I do this? So I signed up right away, and it was just a great way to get that extra information, get that extra practice time. They even go so far, like if you're wanting some more practice with needling, they hire professional acupuncturists to help with that too. So you'll have some peer tutors, but then they also do the professional aspect too. So they're very supportive in the different classes that you may need help in. And it's really nice to feel that you have that opportunity and it's not going to cost you anything. Also, I am part of the student organization at NISA, and my role for that board is the Acupuncture Society of Massachusetts liaison. And so that's the state association to promote acupuncture. And I just want to touch a little bit on the question that was mentioned. Like this could be a really great spot of if you think there's certain laws that may need to be changed, or if you think that there is a place where maybe more people need to learn about things at a state level, this is where about LGBTQ like community, then this is like an option of maybe you would get involved with ASM, or maybe you would even run for SANISA and bring up your ideas on how to do that even more. So just a thought there.
Yes, Amber, and I do want to address that question, and I think we'll address it more when we get into the curriculum and program. That might be a, we'll promise we're getting there. We're giving you the overview now, and we're getting to the good stuff too. So I promise those questions will be answered. So yes, so let's introduce NISA. We're gonna get down a little bit more into what we have to offer, program options and curriculum. So Dean Mosman, if you would like to talk a little bit about, the history of NISA, and I know we talked about how we're going to be celebrating 75 years, but just a little bit from your perspective there.
Yeah, so as I said previously, NISA is the oldest acupuncture college in the United States, founded in 1975. So approaching 50 years in 2025. An impressive number, I think, in the United States. Acupuncture itself has been a profession and, quite frankly, a way of life in Asia for thousands of years. So not quite as impressive as the thousands of years of history of traditional Chinese medicine. But nonetheless, we have been entrenched in acupuncture education for close to 50 years. The profession itself really didn't get organized in the United States probably until the mid-80s. Some of the main national acupuncture service organizations, like the Accreditation Commission for Acupuncture and Herbal Medicine and the National Certification Commission for Acupuncture and Oriental Medicine, those were probably formed in the early part of the 80s and really kind of institutionalized in the mid part of the 80s. And so NISA was at the forefront of helping to shape the profession in its very early days of development in the United States. And we have, been a leader in acupuncture research for many years. We have received, I don't know, somewhere between $5 and $6 million of research funding over the course of our history. You can see here on this slide, we are perennially ranked very high as one of the top acupuncture schools in the United States. So I think that 50-year history has allowed us to kind of constantly review and refine our programs, our courses, the way that we teach clinical training in a way that allows us to graduate acupuncture practitioners that are fully ready to take on the many rigors of running either a private practice, if that's what you're looking to do, or if you want to work in an integrative medical center or hospital, you'll have the ability to have clinical rotations in those kinds of settings. And I answered a question in the chat that was kind of related to that a little bit as well.
This actually might be a good time, Dean Mosen, to bring up the question that is currently in our Q&A. So we do have someone interested, particularly interested in opening up more options in healthcare to the LGBTQ plus community, and wants to know if NISA has done any work to make acupuncture more accessible to these populations, and if so, what does that look like?
So I can tell you for sure that several of our faculty members are serving the LGBTQ plus community and have made low-cost healthcare accessible to that specific community. Absolutely. I don't believe that we currently have a specific external, that's a new word, external clinical placement that serves this community, but many of our clinical placements are serving this community. I won't say indirectly, directly. It's just not an LGBTQ plus specific community clinic. So we have placements in BMC family medicine, in BMC integrative medicine, internal medicine, in BMC pediatrics. We have clinical placements at UMass. We have a lot of clinical placements serving a variety of different communities of patients. We have a clinic in the VA, so I can say with no uncertainty that we are absolutely serving this community. We are constantly looking for new external, oh boy, there it is again, external clinical sites to partner with so that we can serve a variety of different populations. So I hope that answers the question a little bit. And Amber,
Yeah.
I don't know if you
Yeah, there is
you
one
would
other
like
thing
to add.
too.
Mhm.
So coming to NISA, you'll end up assisting, and there's this whole I can't think of the word, but it's like a directory of acupuncturists who are a part of NISA.
Mhm.
And like you'll go out and observe in their clinics, and one of the categories in there listed is people or acupuncturists who serve that community. So I think that that's like a really great way, like if you choose to assist with an acupuncturist who does serve that community, you can get ideas on like what they're doing to better serve that community as well.
So that's a network of practitioners, many of whom are
Thank you.
NISA alumni. And all of our students are required to do, depending on what program you're in, 150 or something around there, hours of what Amber said is called clinical assistantship, which is an observing type of clinical placement. And I think at this time we have probably close to 100 different partners in that network, and some of those partners do serve this community directly.
Great. Okay, so acupuncture and traditional Chinese medicine. Again, Dean Mosman, you're up. This one,
Yep.
this slide is for you to talk a little, to educate us a little more on this.
Yeah, so I many of you may already be familiar with this, but I hate to assume that everyone is completely familiar with this concept of acupuncture and traditional Chinese medicine. And I think in the United States, when we use the word acupuncture, and I often use the word acupuncture with a capital A versus acupuncture with a lowercase a, in this country, the profession has really evolved into being called acupuncture. And I just want to make sure that we understand that what that really means is we're talking about traditional Chinese medicine, which originated in China and spread throughout the world, geographically, for thousands of years, and ultimately reached North America. And in North America, as I said, almost every license is licensed acupuncturist. So we don't have a lot of this usage of the phrase traditional Chinese medicine, but this medicine encompasses a variety of different things, and that's what these bullet points are meant to address. And yes, in traditional Chinese medicine, acupuncture, I know it's capitalized here, but it's because it's a lone word in the bullet. Acupuncture is the insertion of very fine needles into specific points on the body, which bring about some sort of therapeutic effect. That's one part of traditional Chinese medicine, but there are other pieces to it, like the adjunctive techniques that you study when you study acupuncture, like moxibustion, which is an herb that's burnt in certain ways to bring back therapeutic effects, or cupping, which is something that was popularized, I remember, by Michael Phelps in the Olympics. That's probably not that recent of a reference anymore, but that's creating a vacuum effect and using it to stimulate blood flow in the tissues. Gua sha is a scraping technique that is used to kind of bring about a therapeutic effect. And electroacupuncture is attaching those, fine inserted needles to an electrical device that creates muscular contraction and improves blood flow and circulation. In addition, Chinese medicine is typically associated with the study of Chinese herbs. And if you take acupuncture and Chinese herbal medicine, you'll be studying these both. In addition to that, you'll study Eastern and Western nutritional principles and applications. You'll learn a body work that we call Tuina, which is a Chinese based body work that's like a massage therapy that also helps to move tissues and improve circulation. And you'll be taking self-care courses. These are things like Tai Chi and Qigong or meditation. And these are, I'll call them internal self-cultivation techniques that you learn first to help improve yourself so that you can help then care for others better. And so these are kind of the different components of traditional Chinese medicine, quite frankly, of many traditional medicines as well. So that's what I wanted to get across to you with this slide.
So we do have a question that came up while you were chatting on this slide. And it's stating, what is the difference between traditional Chinese medicine and Oriental medicine?
So, I mean, when I see the two, so first of all, that word Oriental, that word has been on a federal level, been removed from describing medicine or people for, I don't know, for quite a number of years now. That is not the case on a state-by-state level. So you still do have some programs referring to this medicine as Oriental medicine. There is a movement within the profession of acupuncture in the United States to eliminate the term Oriental completely. And this can be seen in some of the recent name changes that our national organizations have taken on. When I hear traditional Chinese medicine, I think about a system of medicine that started in China thousands of years ago, and that has kind of then made its way around the world. When I hear the term Oriental medicine, a lot of times that program that may be using that term is signifying that the program is covering all of the bullets on this slide. So if there's a program that you have looked at, it's a Master of Oriental Medicine, for example, it's covering everything on this slide. Here at NISA, the program equivalent to that is our Acupuncture and Chinese Herbal Medicine program. That's where you're studying all of the bullets on this slide versus our Master of Acupuncture only. And in that program, you study everything on this slide with the exception of Chinese herbal medicine. So it's more that the term Oriental is really not a term that is really looked upon favorably anymore. And I think it's very important that we strike it from the record at this point in time.
Great. Well, that is a great entryway into our next slide, because now we're going to talk about the different programs that we offer. So Dean Mosman, I'm going to allow you, again, you kind of just opened that up to talk about the differences between the Masters of Acupuncture and the Masters of Acupuncture and Chinese Herbal Medicine. So if you have a little more that you'd want to touch upon that, and then we can go over our doctoral programs. There was a question in the chat, which I answered that we were going to be talking about it on this slide. So we do have someone that's also interested in the Japanese acupuncture concentration.
Awesome. So again, yeah, I think really what I said is the first thing about our programs are you can either study all of traditional Chinese medicine, which includes Chinese herbal medicine, or you can opt to study everything except Chinese herbal medicine. And that's delineated in whether you take the acupuncture only degree or you take the acupuncture and Chinese herbal medicine degree. So if you're taking that acupuncture and Chinese herbal medicine degree, you're studying all of the pillars of traditional Chinese medicine. Acupuncture, the adjunctive techniques, herbal medicine, nutrition, self-care, Tuina or bodywork, all of those things. We have two levels of programs. We have master's programs and we have doctoral programs. And the difference between them is, number one, it's the number of years of study. Our master's programs are 3 years, and our doctoral programs are 4 years. And those are academic years. So for example, our Master of Acupuncture program is only 32 months, not 36 months. So it doesn't equate to a calendar year, but it is still in academic years, 3 years in length. Our Master of Acupuncture and Chinese Herbal Medicine is 36 months. Our doctoral programs are both 4 years, again, studying acupuncture or acupuncture and herbs. And in the doctoral program, you start to weave in other professional competencies that allow you to communicate, cooperate, and collaborate more effectively with other healthcare practitioners. It has a little bit of a focus on understanding the healthcare system in the United States a little deeper. It has a little bit deeper of an understanding of how to use research and evidence to guide patient care. But other than that, the programs are very, very similar. NISA, in its infinite wisdom, in its almost 50-year development, has always been teaching acupuncture. I'll call it integrative medicine. We've always sent our students to hospitals, excuse me, for clinical rotations, because we've always known that even at the master's level, this idea of integration, of collaboration, and this idea of interprofessional clinical training has always been very important to our mission. So those are the programs that you can take. One of the unique features of NISA that you will not find at most other acupuncture colleges is that we offer a concentration in Japanese acupuncture. And I want to be very clear. It is a concentration. It is not one additional class on Japanese acupuncture. It is 5 courses of 150 hours total, with then clinical rotations that you must take in order to graduate with the concentration. So it's close to about 300 additional hours of training in Japanese acupuncture, which is a different style of acupuncture application than Chinese acupuncture, which is basically what's taught in our master's program. It allows you to treat patients in a different way and allows you a greater resource, another tool in your acupuncture treatment belt to help a patient that may not respond well to traditional Chinese acupuncture. I know from experience, I studied Japanese acupuncture myself, and for my pediatric patients, I found that Japanese acupuncture is especially effective at treating pediatric patients. So it's a little bit different. And I mean, if you were to ask me, oh, Dr. Mosman, should I take Japanese acupuncture? I would very strongly say yes. I think it's a fantastic idea. If you're not studying herbs, I would, if you asked for my opinion, I would say you should absolutely study Japanese acupuncture, because it leaves you even more prepared to treat patients when you graduate.
Absolutely. So we do have a question in terms of flexibility of programs and maybe switching. So if, say, a student maybe started out doing the Masters of Acupuncture and Chinese Herbal Medicine, and they wanted to drop Chinese Herbal Medicine, or vice versa. Maybe they're starting the track to go through the doctorate. How is it flexible to maybe add or drop some of these options to go along with the Masters of Acupuncture?
So the short answer is yes, there is some flexibility around adding or dropping these programs. Everybody's first semester is the same, no matter if you're an acupuncture only or acupuncture and Chinese herbal medicine student. It's in the second semester that you have 2 courses. One course is called Introduction to Japanese Acupuncture, and one is called Introduction to Chinese Herbal Medicine. And it's in these required courses that all students are exposed to both Japanese acupuncture and Chinese herbal medicine. And it's at that point in time that we usually then ask a student to declare their major, so to speak, or their concentration, which is like a Japanese acupuncture minor. And so there is some flexibility. So you declare that program that you want to be in, or if you want to be in a concentration, and moving forward, then you are in a sequence of courses that is fixed in place, right? So Japanese acupuncture 1 is the prerequisite for Japanese acupuncture 2, which is the prerequisite for Japanese acupuncture 3, et cetera, et cetera. If you decide after 4 semesters, I can't do this anymore. This is too much. You can drop the herbal part. You can drop the Japanese concentration and become a master of acupuncture only student. And then if you decided at a later date, let's say after you graduated, you wanted to come back and pursue that Japanese acupuncture concentration, we have a Japanese acupuncture certificate program that you can come back and study. And if you want to pursue that Chinese herbal medicine degree, we have a Chinese herbal medicine certificate program that you can come back for so that you can, take those skills and competencies at a later time.
Great. So some of the fun parts, so clinical training here at NISA. Dean Mosman, I'm gonna have you talk a little bit about how this works. And
Yep.
Amber, if you'd like to talk to us a little bit about your experiences, exposure to the clinic, and your work hands-on with patients.
Yeah, so again, if I had to pick one of the top things, I think that sets us apart from many, many other acupuncture schools are the clinical placement opportunities that you have here. So our clinical training, it sort of comes in 2 parts. The first part is what we call assistantship. It's an observing kind of part of training. And that's where you are either here on campus observing maybe 3rd-year students in our acupuncture treatment center, or you're doing something called clinical theater, where you're observing one of our senior practitioners treat patients, and you are watching and helping where appropriate. So you're watching and helping a licensed acupuncturist treat their patients. That's the first part. The second part of clinical training is called clinical internship. And clinical internship is where you are doing the treating while a licensed acupuncturist watches you to make sure that you're attaining all of the knowledge, skills, and competencies necessary to be a successful acupuncture practitioner. That clinical internship part, then, this is where you have the opportunity to not only treat patients in our community acupuncture treatment center, but to go out into the real world, into hospital placements and other integrative medical settings, and treat patients in an integrated capacity. And you see some of the practices or some of the placements that we talked about earlier. We see those over 90 private acupuncture practices that you can go out and observe in. So to me, this is, if I were thinking about it, what makes NISA unique? This makes NISA very unique. Most acupuncture schools do not have this kind of external clinical placement network like we have here at NISA. Amber, maybe you can comment on some of your clinical experiences to this point.
Yeah, so I started with assistantship, and I actually was put in the NISA clinic quite early. I think it was within like 2 to 3 weeks of starting school. I got to assist in a jazz clinic, and it was just a really great way to start, actually, because you got to see how the intern, which is the 3rd-year student, would come in, how they would do a intake, and how they would like what questions they would ask, and then how they would take that information and they would go back to their supervisor and how they would come up with a diagnosis. And then you would go and see, help them with the treatment. You can't do any needling at that stage, but you can do things like cupping if you've been trained and things like that. Um, and it was just a really great way to actually see like where you're going to end up. Um, and then like learn like taking some notes too of like, okay, so you have to do this when you're doing an intake, and it was just a really great way to start. Um, Also then, you go off and now you're into assistantships that are off-site, which was really helpful for me. My ultimate dream would be to open like a wellness center someday and have different modalities. So when I was looking for places, that's what I looked for. I looked for places that had those multiple modalities and like what it would be like being an acupuncture in that setting, which again is really nice to see like where you want to end up. I also took the opportunity to try like a community acupuncture clinic, which was nice, to get the different exposure and on different ways that people run their clinics. Also, like in a not necessarily in a clinical aspect, but also with like practicing needling, I really appreciated with NISA because they start you off within like the first 2 weeks, I think. You start with like a Lyme, and then like a week after, now you're starting to practice on yourself with the guidance of a licensed acupuncturist. And then you start treating each other. And as someone coming from, again, not working with people before, it was really I think it was really great that we got to do that like right up front. Plus, like I was the person who was a little afraid of needling at first. And I was like, you want me to get this needle in? Like I always couldn't get the needle in. So don't worry, it gets a lot better. You'll get to the point where you're like, oh, I can't wait to go and do these needles so that way it can help this person. So like starting early helps a lot, and I really appreciate that about this program.
Yeah, Amber, you said something really important again when I think about what differentiates NISA from other schools is that clinical training. Like you're an assistant in like 2 weeks. So you have clinical training from your very early days of your first semester until the last day of your last semester. You're experiencing acupuncture clinical training. That's huge. There are many other programs, quite frankly, you don't go into clinic until your second year. You're not observing until your second year. The other thing that Amber said was the idea of needling. You're needling and learning the skills, the acupuncture, the cupping, the gua sha, the moxa, starting from the first weeks of year one until you leave the program. Again, many other schools are waiting till year 2 before you begin to train in those skills. We want you to get that training right from the beginning, right through your entire experience, so that when you leave, you feel fully secure in your ability to perform those clinical skills, and really be able to treat patients day one when you open that practice or when you go into your hospital rotation for the first time as a licensed acupuncturist.
Well, I think we may have just covered the next slide as to why you should come study here at NISA. I know we've talked a lot about a lot of the bullet points that are up on the slide. Would either one of you have anything that maybe you would want to reemphasize or add that maybe we haven't talked about, or just point out, extra specifically as to why everyone should come study here at NISA?
Well, I can always talk, so.
I was gonna say, I do have a question too, so maybe I could start with that. Someone just had a question in. And this is actually something I'd be interested in knowing a little bit more about. What does the acupuncture look like in the field of dermatology? And how can you get involved with acupuncture research?
So acupuncture and dermatology, it's actually a huge subspecialty in acupuncture. So you will definitely receive training in dermatology, both from an Eastern and Western medical viewpoint. And I can, as a practitioner and as a patient of acupuncture, with a history of eczema, acupuncture was the one thing. It was acupuncture and Chinese herbs was the one thing that really made a significant difference with that dermatological condition. So this is something that I think you'll see a lot of out in the field in dermatology. And I will say it is a subspecialty. So there are, a select subset of acupuncturists that are treating dermatology out in the field of acupuncture. In terms of research, you'll definitely have some research opportunities. We are actually in the middle of placing some of our clinical interns in a research opportunity that became available. I don't know that I can talk about the specifics of the clinical trial, but we are routinely putting acupuncture students in front of research opportunities. We also have a fairly recent clinical placement at the Cleveland Clinic, which is an amazing clinical opportunity, one of the premier integrative healthcare settings in the United States. We have been rotating some of our acupuncture assistants through a week-long rotation at the Cleveland Clinic, which is very exciting. And then we have like specific research opportunities where you can do a directed study with a research theme as well. And so there is a center of research here at the university that is committed to providing, research opportunities to students who are interested.
Awesome. There was a follow-up question, that if we could describe, and this maybe have included what you just described, for
I see the question.
traditional, Chinese medicine research opportunities. I don't
Yeah,
know if that's
I
kind of the
think that,
same.
yeah, I think what I said, it kind of covers that question. I will, one little spoiler, one of the people that we're doing research with is Ted Kapchuk, who is like a real bigwig in acupuncture in North America. And so we're very excited to partner with Ted and actually several other alumni who are working at MGH, which is where this research opportunity will take place. And it's a really, really cool premise that I wish I could share with what the premise was. And then I see another question about insurance reimbursement.
Yes.
Insurance reimbursement in Massachusetts is actually pretty good. I feel like Massachusetts, excuse me, is a very progressive state in terms of healthcare. So I think insurance reimbursement is pretty widely accepted throughout the state. Could we do better? Yes, we can do better. We can do better with insurance reimbursement all around the United States. But I think, as Amber said, if you get involved with the Student Association of NISA, which we call SANISA, you might have the opportunity to get involved with the Acupuncture Society of Massachusetts, which is our state acupuncture association. And they're very active at promoting insurance parity and bringing up other acupuncture related bills that we're always looking to get passed here in Massachusetts.
They actually have a bill right now to help get the state insurance to cover acupuncture as well. And we have an acupuncture on the Hill Day on February 20th to help push that bill and help get people coverage.
Great. So again, I know we talked about a lot of what's on this slide. Is there anything else that you may want to add, or anything anything you want to point out about faculty or anything like that before we're going to start talking about the fun stuff of the admission process next?
Yeah, I feel like I said it, but that first bullet there, that hands-on training. I mean, acupuncture it's a manual medicine. The needle is an extension of your hand. And if you are skilled at using your hands, whether that's with body work like Tuina, with needling like acupuncture, cupping, gua sha, moxa, you're going to be a successful practitioner. And so that, again, is why we have our students working with their hands each and every semester, starting in the first weeks of the first semester of the program. And, as nervous as every acupuncture student is to start, I believe in the time that we've been around, we've developed a very sound system that leads to a very good outcome of you being a very good acupuncture practitioner, a good needler, good with moxa, good with cupping, good with Chinese herbs. You're going to walk out of here being confident. Nervous, right? Because now you're going to go open your own practice or treat patients on your own. That's expected, but confident. So that's, I think, the thing that I would reiterate, I guess.
I will add to that too, like, when in the beginning you might be nervous and you feel like you might not be good at this, but you'll be astounded by the improvement that a year makes here. Everyone in your cohort, you'll see the difference, you'll see the change in all of you. So just give it time and it will be greatly improved within a year.
I know we talked about the differences with doing the master's level and then moving on to the doctorate level, but we do have a question with a little more detail. If we could provide a little more detail in the fourth year doctoral program, and how does it set students apart from the master's program?
So the focus of our doctoral program, and really the focus, the whole idea behind the entry-level doctorate in acupuncture, was to equip acupuncture students with the knowledge, skills, and abilities necessary to work with other healthcare professionals towards a common goal of this idea of patient-centered care. As I stated earlier, I was on the task force which helped develop the standards for these doctoral programs, and that's really the main thing. When the master's programs in acupuncture were developed, there was no integrative medicine, there was no complementary medicine. Acupuncture was alternative medicine at best, and voodoo, this non-evidence-based science at worst. And the idea of master's level acupuncture programs was always to graduate practitioners that went into private practice. And thankfully, times have changed. I mean, from when I graduated from acupuncture school too many years ago to think about how many years ago it was, there was no opportunity to go to a hospital at all unless I broke my leg. And that wasn't as a practitioner, it was as a patient. So things have really changed. And so that's the main focus of the doctorate. With that said, I truly believe that this profession will be transitioning to the doctoral level as the entry into the profession within 10 years. I believe that having a doctorate will allow you more upward mobility in the profession, better insurance reimbursement, better job opportunities, research opportunities. There are some places now that will not hire someone unless they have a doctorate. So there will be more access to you as a practitioner. I am hearing rumblings about some states requiring a doctorate to practice in those states. That could be happening in as little as the next couple of years. That wouldn't affect anybody who already had a master's degree and had a license in the state, but times are changing, I think, within the profession. And my recommendation to anyone would be one more year of school. And by the way, that doctoral year is all online. So that fourth year is completely online. You don't have to be on site for that last year of the 4-year program. I would strongly suggest going into that program right from the get-go. And if you don't, is there flexibility in adding it? The answer is yes, there is. So don't sweat it right now. I can help you make a more informed decision once you are enrolled in the program as well.
We do have another question coming in. I'm going to run through the next couple of slides for the admission process, and then I promise we will get right back to questions, but I do want to make sure I touch a little bit about admissions. So reiterating kind of again why NISA and why MCPHS is you're graduating into a promising career. So between growing fields, both in healthcare and acupuncture, we've talked about how we're going to prepare you as a student. So getting you fully trained, and especially even if you're just looking to practice acupuncture or herbs or taking on those specializations, that you are absolutely prepared to go out into the workforce and well paid. So the Bureau of Statistics, in healthcare it's only going up. So including acupuncturists, we're looking at median incomes of, 70,000 plus. So growing fields, being well prepared and trained here at our facilities is to welcome, a well-paying job kind of at the end of that. So a little bit about the application process. Applications are free. There is no application fee associated with any of our acupuncture programs. All of these applications are available online, so directly through our website. Again, so if you were thinking about applying for these programs, you submit the form, which is the application. Will require all transcripts to be officially sent to us, and there is a personal statement for you to explain to us why you're choosing the field of acupuncture and why you'd be a best fit for our program. So if applying, if you do not have a completed undergraduate degree, you do need to show a minimum of 60 college credits completed. Typically, that's roughly about 2 years of undergraduate study, depending on how you organize that out. And then if we're looking at the doctoral program, again, you would need to have all official transcripts sent to us. Their completed bachelor's degree again, or a minimum of 90 college credits on that undergraduate level. We're looking there. And then again, we're talking about the doctor of acupuncture completion, and official graduate level transcripts from accredited acupuncture or traditional Chinese medicine program. So that's where you would add on that doctorate level piece if you are not following from our master's into the doctorate track. If I do have any international applicants, just please know that we do need your transcripts evaluated either by WES, World Education Services, or another transcript service called ECE. And if you do have any questions about that, you can always contact admissions and we'll let you know, does this work, does it not work? But it's a pretty smooth process and free process to apply to our programs. In terms of review, so you would first send in your application. It does go through an admission screening, so we need to make sure that you're meeting all the requirements to be eligible for the program. We take a look at academics. We then pass that on to faculty members of the admissions committee. So there is an interview portion associated with the admission process. So you may have the be lucky enough to interview with Dean Mosman or another one of our esteemed faculty members. So it is a Zoom call. We do these online. It's a good conversation for you to get to know more about us to make sure you're a good fit, and us to get to know a little bit more about you. So always make sure that you have questions ready. We love questions. And really be yourself. This is a conversation. You're not being put up against a panel of judges and they're going to start, asking questions of you or anything like that. I'd like to say it's more of an informal process rather than, formal process. So please don't be scared of it. And we love to have your questions and have those conversations with you. So now we can go into questions. I'm going to open up the Q&A. I did have some prepared frequently asked questions. Kind of just to go through these, we do have some flexible options. So there are some ways that maybe you can have a slower start to the curriculum if you needed to start online. We do have some flex options there. We are hybrid in the fact that some of your courses will be in an online format as well as on campus. Not all of them, but there are some components to the program that, yes, are absolutely hybrid. Our programs are starting in the fall for our year-round academics. We do have some flexible options on the doctorate level, and admissions can kind of go over that one-on-one with you of what might be available. But our on-campus master's program, we do start every fall here on campus. You do not need to come from a specific major or background. While yes, as Amber said, she was coming from more of a science field, we have students that are coming from business backgrounds and corporate and kind of all walks of life. So wherever you're coming from, if you have that passion for acupuncture, we are here to help. International students are absolutely eligible to apply. And we do take in consideration for transfer credit. We'll do a review of your transcripts when you apply and able to give you feedback on what might be able to be transferred in. And domestic students, please make sure you fill out your FAFSA to know what kind of financial aid may be available. Financial aid in terms of the government and loans is through the FAFSA form. Whatever the results of that form are is what you're eligible in terms for government aid. But in terms of aid offered through the school, we do have scholarships available. For this year, we're offering scholarships up to $8,000 per year, which is pretty significant when that is renewable each year that you are a student. So pretty significant in bringing that tuition price down. So I will tell you the sticker price is not the official price. There are scholarships available, and there's ways to have a little bit of flexibility on those funds. So again, those conversations we typically have one-on-one with admissions and can go over all of those options, and happy to help there. I'm going to bring up the next slide of all of my contact information while we answer the questions in the chat. So just for you guys to have it, we have YouTube channels, we have acupuncture videos up there. Please make sure to check them out. On YouTube, we also host copies of these info sessions. So if you wanted to go back and take a look at it, they'll always be available there. And for Q&A, we do have a couple questions that came in. So first one is if we can outline which Western illnesses acupuncture helps best, research substantiated, and what hospital departments do placements tend to be? Diabetes, fertility, cancer, pain, ortho.
Yep, happy to talk about. So this question, all of the diabetes, the fertility, the cancer, the pain, all of the ones that you have listed there, absolutely, acupuncture is pretty well known at being able to treat, and evidence-based. I'd probably add stress and anxiety to that list as well. We use evidence throughout the curriculum in many courses to show you the evidence of where acupuncture is successful. Every one of those examples that I think that you gave in that question, we have rotations. Like, so in family medicine and in internal medicine, you'll see things like diabetes, pulmonary conditions. Asthma is also treated very well with acupuncture. Gastrointestinal problems, irritable bowel syndrome, also another one treated very well by acupuncture. So, you know, again, you'll have the opportunity to pick some of these clinical placements in your areas of interest. So absolutely. Another question was, can you be practicing as a licensed acupuncturist while you're a doctoral student? So because of the way that we structured the program, after your 3 years, you will be eligible to graduate from the master's portion of the curriculum. You'll receive your master's degree. You can then study and take the national boards for acupuncture and get licensed while you're in your 4th year of the doctorate, which is nice because, as I said, that 4th year is remote. So you could actually be a licensed acupuncturist in a completely different state and still continue on in that 4th year of the doctoral program.
Last question we have up is study abroad opportunities, possibly to China, with its extensive network. I'm not sure if we have those opportunities or not.
So we have in the past had opportunities both in China and Japan, but the pandemic has pretty much, I'm not going to say eliminated those. We'll say put those on pause for now. And when things you know, really settle down, I don't want to say get back to normal because I don't know what that means anymore.
Right.
We will probably start to revisit and reopen some opportunities abroad.
Great. So another question that just came in, do you provide tubeless/flying needle techniques to reduce the pain of needle insertion as part of training?
Yeah, we teach all different types of insertion techniques with and without guide tubes. And depending on the proficiency of the needler will determine if there is pain with or without a guide tube. So absolutely, the idea of painless insertion whenever possible is certainly strongly recommended. It's a great practice builder if you're not hurting your patients with every single needle that you put in. So 100% you'll be learning insertion techniques with and without tubes. And people they wind up having a preference for a particular style, right? So some people will leave here and do freehand needling, and some people will leave here doing guide tube needling as well. So.
Great.
Great. really good questions tonight.
Yeah, these have been wonderful questions. Just to kind of reiterate, my contact information is up here on the screen. And again, you can always use my contact information if you had further questions, either for Amber or Dean Mosman. Pretty much anything you need involved with NISA, you can always start with my contact information. If I can't answer the question, I am happy to get my experts on board, and they help answer the questions that I can't. We offer campus tours every month. There's always a Saturday option or a weekday option. Usually if it's a weekday option, it's around the middle of the day, around noontime. Saturday options are kind of usually in the afternoon. If you wanted to just come visit campus and those, campus tour days are just not feasible for your schedule, again, you reach out to me. I am happy to tour you around the building, or set up that, if Amber was available or Dean Mosman was available or another faculty member and student, if you wanted to chat with them while you were on a visit, I'm happy to make all of that work. If you want to come visit a class, we're happy to accommodate that as well. This is my biggest piece of advice when you are looking at any type of college program is a brochure is a brochure. Information on a website is information on a website. I think the best way to really know if you're a good fit is to come visit, walk through the clinic, walk in the classroom with me, take a look around, be able to see students. And then I think you would have a better feeling of whether this is a good fit for you. I have watched some students make decisions without visiting. Sometimes it works out great. Sometimes students come back and say, I thought this was going to be different. Or so really paying attention in info sessions, asking us questions, coming to visit us, whether it's NISA that you choose or another school. This is the first step to learn. And please, if there's any way that we can accommodate you to come visit us and to learn more, we're always happy to do so. With that, this video, we were recorded. So again, we launched them on our YouTube channel. I'll make sure to send a copy out to everyone that attended. You can always look back on this. And again, any questions that come up, please feel free to reach out. And we hope to be seeing your names come across our desk again soon. Amber, Dean Mosman, if you have anything you want to add at the end, that'd be great.
Yeah, please don't hesitate to reach out to me directly if you have any questions, especially about the program, the academic side of things. I'm happy to have long conversations with you and answer all of your questions. So feel free to reach out anytime.
I was just gonna say too, don't be nervous for the admissions interview. I had a great conversation when I had mine and learned a lot more about the school. And two, if you're a student at NISA, you can go to the clinic for free and get treatment. So.
Or $5. I paid $5 to go get treatments. It was the best decision I ever made. All right. Thanks, everyone. Everyone have a great night.
Thank you.
Bye.
Thank
Bye.
you.